Excellent.
Hello, everyone. Welcome. We are so excited to welcome you today to our very first UltraClear webinar with Mountain Radiance Medical Spa. While you're getting situated, I will tell you that not only do we have a great presentation prepared to educate you all on this brand new device, afterwards, we will have some time for a Q&A with Dr. Mark Chandler. So if you have any questions during the presentation, feel free to put them in the little Q&A box in Zoom, and it's going to be located right at the bottom of the screen. And if you have any questions or technical difficulties, you can use that chat feature and I'll be here to support you. So we're just going to take a few seconds to let everyone get settled and welcome in some new people. And then we'll get started in just a moment. All right. Welcome everyone to this wonderful webinar with Mountain Radiance Med Spa. We are here to announce our brand new treatment, UltraClear. This is our virtual launch event with Dr. Mark Chandler, and we're super excited. If you have any interest in laser treatments or in skin rejuvenation, we are going to explain what this laser is all about, what it can be used for, and why you might consider it over other treatments, and also why we're so excited for this new device. We also have a really exciting promotion, so make sure to stay tuned until the end of the webinar and we will explain how everything works. And before we get started, let me introduce you to our wonderful speaker. I'm so pleased to introduce Dr. Mark Chandler. Dr. Mark Chandler is a board certified in emergency medicine and aesthetic medicine. Known for his calm demeanor, artistic eye, and attention to detail, he is passionate about helping patients achieve natural-looking results that enhance their confidence. At Mountain Radiance, Dr. Chandler combines medical expertise with a personalized, patient-centered approach to aesthetic care. And now, Dr. Chandler, if you'd like to take it away.
Thanks, Danielle. So, hey, everyone. Thanks for joining us. I'm Dr. Chandler with Mountain Radiance Medical Spa here in Asheville. Tonight, we're going to be talking about our newest laser, the UltraClear, which is a type of laser resurfacing. So my goal tonight is to help you understand what this treatment can and can't do, what the different treatment levels mean, who might be a candidate, what recovery really looks like. And then we're going to look at quite a few before and after photos. And then hopefully by the end, you should have a much better sense of whether this is something worth discussing for your skin. So what is UltraClear then? So it's an erbium fiber laser. It does ablative skin resurfacing using a wavelength at 2910 nanometers. It's similar to an erbium YAG laser and a CO2 laser, but has some very unique differences. So here's a quick promo video from UltraClear to get things started. So UltraClear is described as the first cold ablative fiber fractional laser. The phrase is a little bit of a mouthful, so let's unpack it a little bit. So ablative means that the laser is going to be removing very small amounts of surface tissue, and that helps to trigger some renewal. Fractional means that we're not treating every millimeter of skin as one solid sheet. We create many tiny treatment channels with untreated skin in between them, which helps with healing. Now, cold doesn't mean that the treatment literally feels cold. It means the device is designed to deliver energy in very short, controlled pulses with less unwanted heat spreading into the surrounding tissue. Fiber is talking about simply the way that the laser is created, using a fiber similar to like a fiber optic cable rather than a crystal gas. And then that combination lets us range from a very light refresh to a very meaningful resurfacing using the same platform, but very different settings. All right. So ablative laser resurfacing itself isn't new. In fact, it's one of the older laser skin treatments. Traditional CO2 and erbium lasers have been used for decades, and they can produce excellent results, but there hasn't been really much progress with ablative lasers since the 90s. The trade-off has often been heat, discomfort, more demanding recovery, and then in some patients, a greater risk of prolonged redness or pigment change. Newer fractional and non-ablative lasers improve recovery, but then lighter treatments may require a longer series and then may not address deeper texture or wrinkles as strongly. So at the UltraClear wavelength, the energy is absorbed very efficiently by the water in the skin, which lets the laser create really precise microscopic treatment zones, meaning that we can be really controlled about depth and density and energy. It's FDA cleared for many common concerns, but clearance doesn't necessarily mean that every setting is going to be right for every person. More, it gives us a range of tools to individualize treatment. So, are you a candidate for UltraClear? The concerns we most commonly talk about are going to be uneven tone and texture, some sun damage, age spots, fine lines, wrinkles, acne, or surgical scars. Some people come in with one specific concern they're looking to address, and others just simply feel like their skin looks dull or rough or older than they feel. Before scheduling a treatment, we need to do a consultation. So consultation matters because not every brown spot's the same. Not every scar is going to respond in the same way. Not every wrinkle is primarily even a skin issue. The laser can improve skin, but it really can't replace volume, relax a muscle, or surgically lift tissue. We're going to review your skin type, how your skin has behaved after acne or cuts or peels or other previous procedures. Also review medications, any recent tanning or sun exposure, and then any active skin conditions. Ultimately, when we're deciding what to recommend, I'm really looking at four things. What you want to improve, how severe it is, how likely your skin is to heal well, and then how much downtime you're actually willing to have. And that last part is actually pretty important. So everyone wants the strongest possible result, but not everyone wants to look like they've had a laser for a week. And the best treatment is really going to be one that fits in with your life. Sometimes the best plan is going to be a deeper treatment. Sometimes it's 2 or 3 lighter treatments that are easier to fit in your schedule. And sometimes UltraClear is not the best tool at all. So if the main issue is facial movement or volume loss or rosacea or laxity, we may be talking about Botox or filler or IPL or another treatment instead. And the consultation is really where we can sort all that out rather than trying to make one laser treat everything. Consults are free, and make sure that we're really on the same page about your treatment goals. This slide really gets into why we brought UltraClear into the practice. So first is kind of comfort without as much compromise. Now, no resurfacing treatment is going to be completely sensation-free, but the very short pulses that the UltraClear deliver limit the excess heat, and then that can make the treatment and recovery much more manageable. Second, it's not one fixed treatment. We can adjust the depth, the percentage of skin that we're treating, the pulse pattern, the different areas of the face. Third is going to be convenience. So a light treatment can fit into a busy week with some minimal social downtime. A deeper treatment can be planned when you're willing to recover a little bit more in exchange for a larger effect. And then lastly, we're not limited to the face. Depending on the concern, the patient, areas like the neck and the chest and the hands, scars, elsewhere in the body can be considered. So this is the Fitzpatrick skin types scale. It groups skin based on color, but more importantly, how it tends to react to sun exposure. With any laser, melanin matters because excessive heat or inflammation can trigger hyperpigmentation, and then in some cases, hypopigmentation. Unlike a CO2, UltraClear gives us options across a broad range of skin tones, especially at the more superficial and moderate settings. But safe for all skin types doesn't actually mean the exact same treatment for all skin types. For a deeper or more aggressive resurfacing, we may opt for conservative settings, pre-treat the skin, choose a stage series, or recommend a different treatment option entirely just based off of the skin type and pigment history. This is a great way to look at, or just really think about lasers in your skin. So skin has layers, and the different treatment categories are going to reach different depths. So the epidermis is going to be your most superficial layer, and then the stratum corneum is actually the most superficial layer of the epidermis. The dermis is a much thicker layer below the epidermis, has glands and blood vessels, and then the hypodermis is going to be the connective tissue that lives below the dermis. So then we're talking lasers. 3D Miracle is going to be the most superficial. It's mainly aimed at some glow, some mild pigment, pore appearance, and some very fine texture. It's going to be targeting the top 10 microns, or about 1% of a millimeter. UltraClear is going to be in the more middle category, although there's still a very wide range within it. And this is where we can start addressing some more visible sun damage, texture, fine lines, and some scarring. And then laser coring can reach much deeper, creating tiny channels in the dermis. And it's really intended for more advanced wrinkles, scars, and laxity. Now, deeper doesn't automatically mean better. More depth means a different goal, more recovery, potentially more risk. And we're going to try and choose the least aggressive treatment likely to accomplish what you're looking for. So for a superficial 3D Miracle treatment, the emphasis here is going to be on skin health, glow, tone, pigment, some mild texture with minimal social downtime. Moderate UltraClear settings broaden that into more texture, fine lines, sun damage, and some scar work. Typical visible recovery may be around 3 to 5 days, although some redness and dryness can last a little bit longer. Advanced UltraClear or some customized laser coring is going to be mainly for deeper wrinkles, more significant scars, or more significant laxity. And then the initial recovery is going to be more commonly in that like 5 to 10 day range. Now, we're talking downtime. This can be a little bit of a fuzzy word, and it can mean different things to different people. It may mean when you feel comfortable on a Zoom call. It may mean when you can put on makeup, or it may mean when every little bit of pinkness is gone, and those are not the same day. Results also develop over time. Superficial changes can appear quickly. Collagen remodeling typically starts showing in around 4 weeks and then continues for months. That also really just affects when we talk about another treatment. So with lighter treatment, we may intentionally plan to do a series fairly closer together, knowing we're not really expecting a huge change with each individual treatment. With a deeper treatment, we don't want to judge the result too early, and the skin may look a little bit better after the initial healing, but collagen remodeling really continues well beyond that. So in other words, the day your skin stops peeling is not the day you have your final result. We'll usually give the treatment time to work before deciding whether or not we should repeat it or adjust settings or trying to address something remaining with a different treatment. So this graphic is really showing the concept behind the pulse technology, which is kind of what makes UltraClear unique. So the laser here delivers energy in very short bursts of kind of purely ablative energy mixed with an adjustable kind of heating type of energy, rather than purely one or the other in kind of one big pulse. The way I like to think about it is using like a fine hammer and chisel to carve out a statue rather than a sledgehammer and a chisel. And that matters because we really want controlled energy to stimulate renewal. But more isn't always better, and then we don't necessarily get extra credit for heating all of the surrounding tissue. Limiting some of that excess heat spread can mean less discomfort, less swelling, and more predictable recovery. We don't use topical. We do use topical numbing for most treatments, and we can offer additional comfort measures depending on the treatment to try to reduce some of the discomfort. But realistically, no resurfacing treatment is going to be entirely pain-free. So this close-up still shows some of the fractional pattern immediately after treatment. Those little dots are the kind of microscopic treatment zones, and they're organized into rings that you can see as we start the video here. So before we start, skin is cleansed and photographed. We apply some numbing when it's appropriate. We're going to be protecting the eyes either with eye shields that here look more like tanning goggles, or if we're going much closer to the eyes, shields that look like small metal contacts. During the treatment, the handpiece moves around in a pattern, cover the skin, and cover the treatment area. Immediately after, skin's going to feel warm, look a little bit red, somewhere between like a sunburn and a prickly heat sensation. Some of the stronger settings, there may be some swelling, pinpoint oozing, or like a bronzing appearance as the skin begins to heal. As far as preparing for the treatment, we'll give you some instructions based on exactly what we're doing. But in general, I want you to be avoiding a fresh tan or significant sun exposure, and then letting us know about any new medications or skin irritation. We'll usually prescribe an antiviral because laser treatment around the mouth can trigger cold sores or shingles. Depending on the treatment, we may also have you stop certain irritating skincare products ahead of time. Recovery. So recovery is going to depend heavily on the settings. After a very light treatment, you may be pink for a few hours and then feel like dry or slightly rough for the next couple of days. Moderate treatment is more likely to give you a couple of days of redness and swelling, like a bronze, sandpapery texture, before that treated skin eventually flakes away. With some of our deeper treatment, the first couple of days are usually the most noticeable. You may have significant redness and swelling, especially around the eyes if we treat there. There can also be some pinpoint oozing or crusting, but most people are looking substantially better by about a week. But that doesn't mean that necessarily every single bit of pinkness is gone. During that time, we want you cleansing gently, keeping the skin covered with products we recommend. Try not to pick or speed up the healing of the peeling. Once it has peeled, sunscreen is incredibly important. Just because the peeling is done doesn't mean the healing is done, and your skin's still very vulnerable to UV radiation. Now, increasing pain or fever or something seems to get worse rather than better would be reasons to give us a call. Most recoveries are very straightforward, but we do want you to know that we're available and you don't have to figure this out. So here we can see an example of an example of recovery progression. Now, every healing is going to be different based on settings and the individual skin, but this looks like about a moderate type treatment. So a little bit more intense than a 3D miracle, but a little bit less than intense than a really in-depth coring. You can see the first few days of recovery are the most significant, but then at day 4, she's really looking much better. And again, this isn't going to be everyone's experience, but it's a good example of things changing over that first couple days. So then let's start with the lightest end of the spectrum. So this is the 3D miracle. These treatments generally don't require topical numbing. It's available if you'd like, but just make sure to ask for it when you're booking so we can schedule the time for you. This treatment's useful for someone who really wants more of like a brighter, smoother looking skin without committing to a full week of recovery. So think of like a refresh, polish, glow rather than a deep resurfacing. It can also be used as a series when gradual improvement fits better into your schedule than like one aggressive procedure. It's still a laser treatment though, so there still can be redness and dryness and flaking, but compared with a deeper resurfacing, it's much easier to fit into a normal schedule. The right patient here is often prioritizing tones, mild texture, poor appearance, and overall radiance, but not expecting to erase like a deep wrinkle or dramatically tighten some loose skin. So here's some before and afters. So here we're looking at 1 month after one treatment. And what we're looking at is some overall improvement in the evenness of the skin tone. The redness, some small areas of some of the discoloration are a little bit calmed down, and the skin just looks more uniform. Here's another 1 month result for some moderate skin damage. It's a really visible reduction in the blotchy redness and the brown discoloration. Overall, just smoother appearance. And this is a kind of global improvement that we're looking for out of a superficial treatment. Here in the side view, we're looking at the cheek texture and just the way the light reflects just evenly just after one treatment. So this example, we're looking at 5 weeks after one treatment. It's showing that it's not just limited to the face. So the surface texture just looks smoother, more even, and the wrinkle appearance is even improved. The ability to fine tune the treatment is especially valuable on the neck and chest where the skin is a little bit thinner and less forgiving. Here we're looking at a higher Fitzpatrick skin type, and we're moving into the clear treatment range. So it's similar to a 3D miracle, but goes a little bit deeper down into the epidermis. Recovery is going to be a little bit longer than the 3D miracle, and some people may choose to do it without numbing, but I generally recommend topical numbing starting at about this level. And here, I mean, 5 days, you can already see improvement in the visible pigments and brightness. It's a very nice early result, and the remodeling and pigment clearance can really only get better from here on. Here we're looking at a great example in a darker skin type. So she did a series of 3D miracles. Her skin looks brighter, more reflective, tones more even some of the scattered pigmentation soften. This is what we're looking for with the 3D miracle, just an overall like healthier, smoother appearance without an aggressive treatment or a lot of downtime. This is a great example of treating a little bit more concentrated area of pigmentation. You can already see some fading at 6 weeks after the first clear treatment. And 4 months after the second, it's dramatically less noticeable, blends much more naturally with the kind of surrounding skin. Not every pigmented lesion is going to respond this completely. And it's one of the reasons that we evaluate spots before treating them. But this really shows how results continue to improve with time and additional treatment sessions. Here we're looking at 10 months after 2 treatments. Cheek has a much more even tone, smoother appearance. There's a lot of improvement in pigmentation, but it really does emphasize the need for multiple treatments, especially with some denser pigmentation. Here we're seeing a close-up showing some pore refinement, some improvement in the fine texture. It's 2 treatments. Now, pores don't literally disappear, but what we're doing is making the surrounding skin much smoother, and it can help make them much less noticeable. And here we're looking at an off-the-face treatment. So we can treat hands, arms, legs, chest, really anywhere on the body. The hands a lot of times will reveal a lot of sun exposure, even when we take great care of the face. Here we're looking at 5 months after a third treatment and a lot of reduction in some of that model. So now we're going to be moving on from a more superficial refresh into a more of like a moderate resurfacing. That's where we can ask a little bit more out of the treatment, but need to allow for a little bit more recovery. So depending on what we're treating, there may be a few more days of downtime, and we may need more than one treatment to achieve our goals. But this is where the treatment decisions really come a lot more personal. So if you're mainly interested in glow, some mild pigment, some preventive maintenance, you really don't want downtime, a lighter or moderate treatment may make the most sense. And if you're looking at more established sun damage, fine lines, acne scarring, we may be moving more into an intensive treatment to give you more improvement per session. But neither choice is automatically better. It's really more of a question of would you rather have several easier recoveries or fewer, more involved treatments? And some people would rather do a series of lighter treatments, but some people say, if I'm going to do this, I'd rather have a week of downtime and get as much improvement as we safely can. And both are really reasonable strategies here. So here, 5 weeks, the crepey texture and some of the fine lines in the eyes, they're noticeably softer with firmer looking skin. Here we're seeing a scar sequence, which shows 1 month after one treatment and then 2 months after two treatments. And you can see how the scar becomes flatter, less pink. Scar improvement in general is really a process, and the goal is going to be a softer, less conspicuous scar tissue, not making it vanish altogether. Here we're looking at 1 month after one treatment, and we see the overall tone is more even, the face looks more refreshed, but still very natural. Here she did a customized treatment. It's chosen around her particular pattern of sun damage and texture. And here at 2 months with only one treatment, there's a lot of just global improvement across the face. Here we're looking at 4 weeks after a single treatment. And you can see how the lower eyelid texture and fine creasing have dramatically improved. Here, 1 month after one treatment, you're seeing a lot of improvement in the light reflection off of the cheek, and it's a lot more smooth and even. Here we're looking at a 20-day result, and it's really showing a visible improvement in some of that mottled sun damage and roughness. Now, 20 days is pretty early on. The collagen changes are really just going to start just beyond this and continue even throughout the next weeks to months. But even at this early point, you can see a lot of meaningful softening of that acne scar texture on the cheeks. This is 1 month after 3 treatments to the neck. Now, neck skin heals differently from facial skin. It can be a lot less forgiving. So a series of appropriately chosen treatments can be a lot safer than trying to force the entire result into one session. What we're looking at here is the horizontal texture. It's very substantially improved. Now, she does still have some remaining vertical bands, and these seem to be more related to the underlying neck muscle, so they would generally require a different treatment. Here at 1 month, we're seeing some improvement in some of that discoloration, the overall tone, as well as some of that acne scarring. We don't routinely perform cosmetic treatments on kids, but it's a great scar treatment example. And it really demonstrates how precisely we can dial in the treatment. So you can see some of that early redness during healing and then improvement as the scars remodel. Here we're looking at 5 weeks after one treatment, and in profile, she has a much more even tone and softer surface texture. I love this one. We're looking at 4 weeks after one treatment targeting the skin texture of the cheeks with a lot of acne scarring, and then a darker Fitzpatrick. Still early to really judge the final result, but very nice. Here we're seeing another darker Fitzpatrick with acne scarring. And we also see a little bit of the healing progression. So we're looking at before 2 days, 6 days, and then 8 weeks after one treatment. Really nice improvement. Here we're looking at 6 weeks, and the lower cheek and jawline and neck really appear much smoother. Here we're looking at 3 months after 3 treatments, and there's just a cumulative improvement in the texture and tone. Skin looks just much smoother, more refreshed, particularly through the cheeks. All right. Final category we're going to get into is laser coring. So this is the most intensive end of the platform. It's really for patients who are seeking more substantial remodeling and people who are comfortable with a longer recovery. Honestly, laser coring is one of the main reasons I bought this. It gives us a way to create true microscopic columns of tissue removal while we're able to control the size and depth and density of these columns. Now, there are mechanical microcoring devices out there that pursue a similar goal using hollow needles. But the advantage of the laser is really the degree of customization and range of areas that we can treat. Now, is this for everyone? No. This is more aggressive treatments. Generally, we're looking at around 7 to 10 days of initial recovery. This depends on the settings and the patient. And because it's a deeper treatment, we're going to be using a more comprehensive comfort measures. So this is topical and injectable numbing, nitrous oxide, and even oral medicines. But in the right patient, it can really produce remodeling that we can't get from a superficial laser treatment. So here's a great video that kind of goes into laser coring. So laser coring creates very small, deep channels or cores through the skin. See, these are microscopic columns, not like large holes. And I'm not only able to control the size of the channel, but also the density and depth as well. So the channels themselves are larger than the individual pulse size, and then it creates the core by doing a rotating pattern of pulses that then spiral down into the skin. And this video is showing a really slowed down representation of what's happening, but the pulses are actually fired at 5,000 hertz or 5,000 pulses in 1 second, which is really absolutely amazing from a technical standpoint. But then the skin heals by contraction, which then helps to address some of those deeper wrinkles and scars and some of that skin laxity. So here, after one treatment, the patient has a smoother cheek and lower face texture with a just more rested appearance. You can especially see below the chin and the texture of the cheek and then around the eyes. Here we're looking at 5 months and the neck contour and the kind of crepey texture visibly improved. This is the collagen remodeling, so the timeline is really measured in months. Right? So here we're looking at 6 weeks, and the lower face and neck look smoother, especially along the jawline. 6 weeks is early enough that additional remodeling is going to continue, and the patient really got an amazing result here. So a few more pictures of her coming up too. Lines around the mouth are a common reason why people ask about a deeper resurfacing. So at 6 weeks, they're softened but not erased. Movement continues to create lines, so combination treatment sometimes can be helpful. And we also have other options to help with this too, including other lasers, peels, and filler. But for one treatment at 6 weeks, this is a pretty substantial improvement. And this angle is showing some improvement in that coarse texture and fine wrinkling of the lower face and neck after just one treatment. And then here we have one treatment at 1 month, and it's really showing kind of what it can do around the eyes, and that under eye texture is just noticeably smoother. So that was all of the before and after. So anyone who feels like this can be a good fit, we do have a webinar offer tonight. This is going to be 20% off of an UltraClear treatment that has to be booked by August 21st. And then the first 5 people who book also are going to get 20 free units of Botox. The offer includes a consultation, so we make sure you're a good candidate and choose the right treatment level. How do you take advantage of this? So just give us a call. We'll book you for a consultation, an appointment. And don't worry if we have to adjust the appointment after the consultation. That's perfectly fine. Just make sure that we're reserving your time slot. And then I'm usually doing treatments on Thursday afternoons, especially for the more intense treatments, so you have the weekend available for the worst of the recovery.
Amazing. Well, Dr. Chandler, that was fantastic, and I can't wait to get my own treatment. And just to reiterate, for everyone attending live today, take advantage of these incredible offers. Again, 20% off UltraClear treatments, and definitely try to be one of the first 5 to book because you will be eligible for the 20 units of Botox complimentary. So, definitely call that number on the screen, and we are standing live, so we're so excited. And again, thank you so much, Dr. Chandler, for the wonderful presentation. I hope you all learned a lot. And please feel free to go ahead and enter any questions that you may have into the Zoom Q&A chat box. Let's see, we do have a few questions in here right now, so if you're ready, I'm just going to go ahead and fire away.
Yeah, sure.
All right. Let's see. What does the aftercare treatment look like?
So aftercare is going to kind of fall into 2 different categories. The 3D Miracle is pretty much some vinegar soaks for about 24 hours, a light moisturizer. Don't really need to do a ton. Once we're talking into the kind of ultra clear coring range, then we're talking about gentle cleanser, vinegar soaks, and then kind of a thicker ointment. So think like Vaseline. That's really going to be lasting for 5 days or so. It really depends on when you're done with the peeling phase, and pretty much nothing else. So I'd love to have you using a sunscreen, no other topicals, really, really safe, basic things. Once your
Amazing.
skin's done peeling, that's when we can restart the sunscreen and restart some of the other topicals that you've been using, or like a regular moisturizer.
Okay. And let's see, we have another question, and it's asking if UltraClear, any of the UltraClear settings can be used on patients with rosacea.
Um, as far as rosacea, we can use it in people who have rosacea. It is indicated to help with some of the vascular dyschromia, so some of that kind of reddish hue. But if we're talking about like really intense reds or superficial capillaries, then we may want to be treating those first with something like an IPL to see if we can clear up some of that more intense red vascularity before we move into something like an UltraClear. So, short answer, yes, but it's not the treatment I would necessarily reach for rosacea.
All right. And then let's see, we have another question. How long would I have to stay out of the sun?
So beforehand, we're really going to want you to be diligent with skin protection for, I mean, honestly, 4 weeks would be the best. And that's really not having any sort of like significant sun exposure. So think like beach or, don't go into a tanning bed. And then using, sunscreen well for the 4 weeks ahead of time. Afterwards, you're going to need to stay out of the sun until your skin is done peeling, and that's mainly for like the ultra clear coring. And then be using sunscreen pretty diligently for the first like 4 to 6 weeks. And it would be great not to have any really significant sun exposure. So again, thinking like beach or cruise where you're going to get sun no matter what. So the biggest concerning windows in that kind of first 2 weeks, but ideally 4 to 6 afterwards.
Great. Let's see, we have several more questions. Would you recommend a particular age range for an UltraClear treatment? Is there a preferred age for this laser?
So there's that's the beauty of this is pretty much all age ranges. Now, I don't treat kids again, so 18 is going to be my low end cutoff, but there's good options for light treatments and kind of superficial polishing, refreshing, a little bit of kind of like rejuvenation for typically more in your kind of 20s and early 30s, a little bit more intensive for kind of late 30s, 40s, 50s. And then we can also add in coring for, up until 80s, 90s. As long as you're caring about your skin and wanting to make an improvement, we really have options to treat you here.
Amazing. Um, Someone would like to know, does this help with sebaceous hyperplasia?
Yes. Yeah, it's a little bit more, the treatment would be a little bit more customized to that. So it'd be about shaving down some of the sebaceous cyst and then layering in some settings on top of that. But yes, because it's ablative, we can deal with the sebaceous hyperplasia.
Right. And then can you do different levels within the same treatment session? So an example would be maybe laser coring around the eyes and perhaps a light or moderate treatment on the rest of the face.
Most definitely. And that's why a consultation is so important, because every treatment's not going to be the same. Some people may just want kind of a light refresh everywhere, but a little bit more intense around the eyes. Some people, similar story, but just around the mouth. Sometimes we're just treating a neck. We can do just isolated treatments, but I do like a little bit of treating the entire face and then focusing in on specific areas. Another good example would be acne scarring that tends to occur mainly over the skin. So we don't need to do the same intensity of treatment for let's say the forehead where you don't have acne scarring as we would for the face. And that's where we can really customize what is important to every individual person.
All right. And then we've had some questions around cost. And I
Mm-hmm.
know that, there's definitely going to be a range just based
Mm-hmm.
on 3D Miracle versus UltraClear versus laser coring. So I know that it definitely is going to be very much on a case by case kind of basis. But if there's anything that you'd like to kind of speak on related to that.
Sure. So cost wise for a 3D Miracle, we're starting at 750. Once we're talking about going into the ultra clear kind of range, we're talking about somewhere between 1,250 to say 2,100. And then when we're talking coring, because it's so individualized, it's more what I consider like a la carte. So, for around the eyes, for example, I believe it's 750. Yeah. And piecing all of that together is kind of what your individual treatment costs, and that's where again consult is going to be so important.
Amazing. And I just wanted to reiterate that this offer expires on August 21st. So you definitely have a little bit of time, but again, to be one of the first five that book, you will also receive a complimentary 20 units of Botox. So that's definitely a little incentive to, sooner rather than later, just to take advantage of, these amazing offers. And I believe that's all of the questions that we have for
Yeah.
today. So thank you so much for everyone for attending. And thank you, Dr. Chandler, for such an amazing presentation and for all of the answers to these questions.
Thanks, Danielle. So, like, the main thing I hope that everyone really takes away from this is really that UltraClear is not like one single standardized treatment. It's more of a platform that just ranges anywhere from a lighter kind of refresh to kind of more of a deeper resurfacing, laser coring, and then the right choice really depends on what bothers you, and then also your skin type, your medical history, how much improvement you're looking for, and then how much recovery you're willing to have. That's again, I keep plugging consultation. That's where the consultation is so important. All right.
Amazing. Well, we can't wait to welcome everyone to the office for their treatments. And again, thank you so much to everyone for attending today. All right. Have a
All right.
great night,
Thanks.
everyone.